stars up above. Let we dance now. Take a chance now.
Welcome back inside the Now Morning Show. It's Tobago Thursdays, and this morning we want to let you know how you can do some self-care, especially if you're diabetic. And we're putting that inside your spotlight on now.
Continuing the conversation this morning, of course, off the heels of World Diabetes Day that took place on Tuesday, we're now going to be talking about self-care for diabetics. Joining us is Delicia Burris, the Chief Executive Officer and founder of Glorious Touch Health and Wellness Spa. Good morning, Delicia, and welcome to the show.
Hi, good morning. Thank you so much for having me here.
It's a pleasure to have you with us this morning. How are you doing today?
I'm doing wonderful, thank you.
Wonderful. Well, looking forward to this conversation where we're going to get some more knowledge and a little insight into self-care for diabetes particularly. Let's talk about that first of all, Delicia. How crucial would you say self-care is in managing diabetes?
It is very important because the thing is, your feet is actually the most neglected part of your body. And the thing is, with some people, especially who have diabetes, is when they have thick callus and overgrown nails, then when they start to notice, oh goodness, that when they have to start to do something. But they need to be checking their feet almost every day, moisturizing their feet and so on. So with that now, they need to start to be taking care of their feet every day. So with that, self-care is crucial, especially for diabetics.
Thank you so much for sharing that, Delicia. So I know feet are super important. Glad that you jumped straight into that point of the conversation. But let's take it back to your skin as well, because the skin is the largest organ in your body and can also be affected by diabetes. So what can we do ourselves to ensure that we don't fall prey? Well, those of us, of course, who have been diagnosed or are pre-diabetic, that we don't fall prey to any sort of skin conditions.
For one, always wear sunscreen. Two, when you're coming out of the shower, make sure and dry your skin, especially between your feet, so no type of fungal infection could form. And also moisturize those feet because those natural oils does always come off. You need to put back the moisturizer there. And lastly, make sure and take care of your skin. Some people think that, oh, it's not so important and why waste money on cream and moisturizers, but it is so important, especially for a diabetic.
Delicia, one of the things that you've spoken about twice so far in our conversation is moisturizing. And one of the things that we see when we go, to perhaps the pharmacy, we go to markets and so forth, are specific products that are created for diabetics. Is it that those who have diabetes need to use those products specifically, or can we use any moisturizer or oil?
It is actually have specific moisturizers for diabetics, nothing too harsh for the skin. So they are actually cost-effective type of moisturizers. So when diabetics actually come to my spa, I do recommend certain moisturizers for their skin because you have to be very careful. You don't need any type of harsh moisturizers to crack or even cause any harm to your skin. So you could go to the pharmacist and they could recommend over-the-counter creams for them.
Great. So what self-care practices would you recommend, aside from moisturizing and, of course, just that general health care? Do you have any other self-practices that you would recommend to those who are living with diabetes?
Yes, I could recommend 3 for sure. 1, manage your glucose levels, eat healthy. 2, make sure and take your medication as prescribed, as your doctor said. Some people think that it's not important, but the doctor knows best. And 3, always practice at least, even if it's once a month, a self-day care for sure. Even if you have to go to a spa, make sure it is a spa that is diabetic safe, so that don't use harsh or even sharp objects for your skin because your health is your wealth.
Aside from sharp objects for your skin, which is always a big concern when it comes to diabetes, specifically going back to what you mentioned in the beginning when it comes to foot care, what other things will categorize a spa as diabetic safe?
For some, you need to have someone who studied and specialized for diabetics. Like for me, for example, you need to make sure that they know what is for sensitive for diabetic skin. They know what causes diabetes, especially if someone has sores or even fungal infections, for example. you need to know what you are working with. For some spas, they just want to use certain things or just brush over the fungal infection and actually make it worse. You need to let somebody know what they are doing.
Okay, so this is something new, at least for me this morning, learning that those who are trained, you will go through different categories of training to learn how to deal with different individuals as well. Now, let's talk about mindfulness or relaxation techniques, because one of the things that you mentioned, of course, is taking that day to go to the spa. But what about your mental space? What recommendations do you have, or do you have a practice that you would say is something that would benefit those who are living with diabetes every day?
For one, people think that with diabetes it's just to test your blood sugar and go on about the day. But the thing is, with diabetes, it does actually affect your mind. So I does always recommend for people who going through a lot, you are not alone. It is good to go to someone, talk to someone. You even have the Diabetes Association that I just now joined. You also have the Lifestyle Clinic, talk to someone, or even just go for a walk, relax, or even go for a massage. That's and all I does include with my spa. Those type of things that help relax a person. Don't think that you are just fighting this alone. There's lots of people in Trinidad and Tobago that have diabetes.
There definitely are as well. Of course, in our conversation, we learned just how many people, talking about earlier on this week, are living with diabetes and how many people are living with it and are unaware of that fact. Tell us, with your spa, Glorious Touch Health and Wellness, how many people do you see coming in, let's say, on a weekly basis who are living with diabetes?
On a weekly basis, I does actually get 13 to 15 persons a day that have diabetes. And even to a point when I ask certain questions and even just see certain symptoms, I just actually tell them, you sure you have diabetes in your family history? I've seen certain type of cuts or sores, how long you had it sore for, and when you actually get into the ditch of the questions and more deeper in, I just recommend for them, here, I think you should go to your nearest health center, get tested, make sure you do a HbA1c, all those type of questions to make sure, because some people doesn't want to know that they have diabetes or afraid to even want to know that, oh my goodness, if I have this, they don't want to accept reality. But the thing is, even if you have it, you could live a long life with it once you manage it.
Now, Delicia, that is quite a lot. I mean, talking about 30 to 50 people a week who are coming in, who are with diabetes, especially, for one organization. Have you seen progress in those who come and improvement over the months with their visits?
Yes, I do see improvements because some of them does actually make up their mind to say when you actually go through with them with all the stuff that's going on with their feet, some of them does actually go to certain salons and due to some of the salons that doesn't know what's going on, hence the reason why I does always say pick a salon or a spa that know what they're doing. Some of them do go through with the recommendations I tell them and you'll see a grave improvement. And I just love that with my clients. Some of them do, a little bit don't, unfortunately, but still I will work with them no matter what.
Now, talking about who you work with particularly, we know that you are specifically trained. Do you also work with healthcare providers as well to, well, treat your patients? Let me not say patients. Let me say treat those who come in, because I know that obviously not a medical center per se.
So yes, well, I also do work in a health center. So yes, at times. So with the clients I do work with everything, it it do help. So with the clients, it is wonderful. And with the clients, everything, some of them, for example, one of them who do had a big problem with their feet with with a fungal infection actually. It actually went away after constant treatments. And it got so well to the point that right, it has come for normal maintenance, everything. So I'm actually happy about that. That is one testimony I could always tell other clients that if you continue, you will get better.
So, Delicia, walk us through, if you can, what it's like coming to the Glorious Touch Health and Wellness Spa for those who are living with diabetes. What is a typical visit like? Is there anything that's done differently at your spa versus a non-diabetic friendly salon or spa?
Sure. So one of the things that I do when I come to the client, I do ask certain questions before when a client book with me. When I come to them, I check out their feet, I ask certain questions, make sure that I know what's going on with them, ask if they have any allergies, ask if they have any fungal infections, what's going on. Then when I check out their feet, do my certain things like clean the feet, do the foot restoration service, and while going on like scrubbing the feet, doing the exfoliation treatment, all those things going on, scrub their feet, all those things. And if they have any type of fungal infection, start the fungal infection treatment and start to set an appointment for the next time. And even do a massage as well, that is also included, a foot massage. So if they have any type of knots, we just call it any massage service, knots in the feet or any type of problem in the feet, so they can relax as well. And set a date for the next appointment when needed.
Well, you piqued our interest when you said foot restoration service. Let's talk about that very briefly. What exactly is a foot restoration service?
So some people, especially men, doesn't want to hear pedicure because it sounds so feminine. So we rather say foot restoration than pedicure, because pedicure sounds more salonish than foot restoration. So it foot sound more open to the public than pedicure. So a lot of people rather hear that. Yes.
Okay, interesting. Foot
Yes.
restoration service. I like that. I'll see how I can fit that in now to my vocabulary. Delicia, do you have any closing comments for Trinidad and Tobago before we end our conversation this morning?
Yes, so I will say that, guys, please take care of your feet. Don't wait until it's old, when you're old age and just thinking, all right, your foot aching, start to look at your feet, everything. And the reason why I opened Glorious Touch is because my elderly grandfather, who was bedridden and had diabetes, we was looking for someone who was specialized in diabetic pedicures. We couldn't find anyone in Tobago. That's the reason why I opened Glorious Touch. And I fell in love with it. So he was actually 90 years old at the time. And because of him, and I learned about all the leg issues. That's the reason why I would teach people to, hey, take care of your feet now at your young age, even to the people who's elderly, take care of your feet now. Your feet is your wealth. Take care of it. It's the first thing you use as soon as you get up to the last thing you go to bed. It is very important.
Moving. Thank you so much for sharing that and being with us this morning, Delicia Burris on Now. Looking forward to hopefully having you back sometime in the future so we can continue the conversation and, importantly, raise awareness.
Thank you.